Well, I would rephrase it. I don't think there's any such thing as an extra dose, but there are entities that are going to be receiving in the first wave here more dose than in a week than they can administer in a week. And so there may be some leftover dose from 1 week to the next. But the point is that we need to try and get that vaccine out as close as, so every entity that receives vaccine, whether it be a hospital, a fire department, an EMS agency, a health department, a doctor's office, a clinic, we're expecting that they will adhere to the tiers and try to get through those. But even last week, Dr. Hellerstedt, the state health commissioner, came out and said, when it looks like you're getting to the end of your 1As, then go to the 1Bs. And if it looks like you're running out of the 1Bs, then start, move on from there. And the point is that nobody wants there to be any dose sitting around waiting when so you need to have three things. You need to have vaccine, you need to have somebody able to administer it, and you need to have somebody willing. So if you have all three of those, the vaccine should be moving. But there may be a time when you got more vaccine than you have people that are, you don't have enough people available to inject. And I suspect there was a little bit of that perhaps in the beginning. But as the hospitals, because they got the largest doses, they've really ramped up. They really have now got, I don't know what the right term to use, but they've got really sophisticated, aggressive systems to get a lot of dose out quickly. And then, of course, you have to have people willing to take it. So right now, we probably have what we're hearing, certainly in the fire departments, we're hearing more people who are interested in taking the dose from the first responder community than we had anticipated. So that's a good thing. So I don't know about extra doses, but at any point you could, all those three things are not going to be at the same level at the same time. So there's going to be a little bit of moving back and forth with that. But yeah, those will move.